So, getting a facial done to cleanse your skin maybe once in 2 months is all right. Botox is a medicine for migraines, for excessive sweating. I've had people come to me and say, she's playing this character, so you have to make her look glamorous. So, for that movie, she's going to look glamorous, or he's going to look 10 years younger.
For example, Deepika Padukone. Now, when she made an entry into the movies, she was slightly darker, little different features as compared to what she has now. She has a more pointy chin, she has glowy skin, and her face shape is also slightly different.
Oh, yes.
वेलकम टू परसेप्शन एंड बियॉन्ड. फ्लॉलेस स्किन और परफेक्ट लुक्स ये सिर्फ इंस्टाग्राम फिल्टर्स तक सीमित नहीं है, ये रियल लाइफ में भी अचीवेबल है. आज हम मिलेंगे डॉक्टर जयश्री शरद से, जो एक सेलिब्रिटी डर्मेटोलॉजिस्ट हैं. वो हमें बताएंगी कि फ्लॉलेस स्किन के पीछे का सच क्या है और कैसे हम अनरियलिस्टिक ब्यूटी स्टैंडर्ड्स को तोड़ के अपनी असली सेल्फ इमेज को एम्ब्रेस कर सकते हैं. Ready to break some beauty myths? Stay tuned. Hi Jaishree, welcome to Perception and Beyond.
Thank you so much for having me.
So, getting started with the first question, I would like to ask you, skin being the largest organ in the body, and you have been dealing with skin for almost over 2 decades. How does the skin impact somebody's self-esteem and overall perception of themselves?
I think in a huge way. I'm first of all very glad you told the audience that skin is the largest organ of the body, and people don't know it, and it's often disrespected. And then these days, when you have the skin talking to you in the form of acne or hyperpigmentation or scars, it's not just about body shaming. It tends to sort of eat into your system and affect your self-esteem and make you feel underconfident. In all these years I've seen people, and now with social media especially, post-COVID, it's alarming how bad skin can really affect you. And on the flip side, great skin, radiant skin can actually make you into a different confident person. So both ways, I think skin has a major role to play in how you perceive yourself as an individual, how confident you feel when you look at yourself in the mirror, when you're talking to people, when you're presenting yourself, everything. And I also think taking care of your skin is all about self-love.
Very true. Absolutely. So you've authored 3 books: Skin Rules, Skin Talks, and Skincare. What really inspired you to write so extensively about skin? And do you really think that this is a need of the hour when it comes to people becoming aware about the skin health?
So the first book, it did not come from within. It was basically Penguin, Millie Ashwarya, who was the director, that time the editor, the head. She reached out to me and she said, "You must write a book." And I was like, I'm not an author. And she said, "But I was on Femina for a very long, associated with Femina. Like I used to have a full page column back then. And I was writing for a lot of other magazines like Harper's and Vogue and, Women's Era and all of that." So she said, "You're anyway doing this. So all you have to do is compile them together." So I sat on that idea for about 8-10 months, kept saying, "No, I don't know how to write. I write medical journals, I write medical books." She didn't give up on me. And that's how the first book, Skin Talks, came about. Um, it became a bestseller. And then I realized suddenly that when I got feedbacks, that Skin Talks was for people who wanted to know about skin. It was not for lay people. Why? Because it was my first book. A lot of information out there, a lot of technical language, a lot of scientific language. I said, this doesn't work. I wasn't happy. Um, and then they reached out to me again saying, "Time for your second book." So this time I said yes immediately because, I wasn't happy with the first book. So I said, okay, I have to simplify skincare for people. People won't understand if I say collagen and elastin. And back then, if I said retinoids and this and that. Now, if I say all this, people will understand. So that's how the second book, Skin Rules, came about. More simplified, more relatable, more anecdotes. What happened in the clinic, some stories here and there, as you talked about self-esteem, how this kid who was a 17-year-old and he wouldn't step out of his house, wouldn't make friends, wouldn't go for events. He had completely shut himself because of his acne, and how I helped him over the next 4 to 6 months, and he turned into a new leaf, a new version of himself. So those kind of stories, real life stories, that was Skin Rules. And then during lockdown, I was doing a lot of Instagram lives. And so Gurveen, my editor for the second book, she reached out to me again from Penguin and said, "Hey, I think you should do a third book." And I'm like, "I've already put everything out there. What do you want me to do?" She said, "Why don't you just do these Q&As that you're doing on Instagram?" And so, I realized when I was on Instagram those days, and you had 28 hours to yourself, but otherwise you didn't have time. I realized there was a lot of knowledge, there was a lot of misinformation, right? Number one. Number two, people were overwhelmed with the kind of info that was churning out. People didn't know what to use, what not to use, so many products, and then so many influencers, and then also dermatologists, and also, actors, or people just talking about their skincare. And I used to do online consults, and half the time it would be people who have used some product and they've had side effects. So I said, no, this has to be clarified now. Now people are beginning to understand about products, and now they want to use everything just because they know of a retinoid or a vitamin C or a AHA, BHA. They want to use AHA, BHA, hyaluronic, vitamin C. You don't need, your skin doesn't need so many things. You may just need one or two things at the most. And so that's how I said, no, I have to debunk these myths. I have to make them realize the science behind what they're doing and what is the importance of a holistic skincare. And that's how the third book came about.
So tell me something now. Everybody has this misconception around skin health and facials. Now, everybody wants to go for a gold facial, for a diamond facial, for a youthful facial. Now, does facial really work externally when we talk about, acha, now I want to go for a facial because my skin is looking very dull? Does it really work? Is that something which you would validate, that facials really help your skin become more youthful and more glowing?
You're putting me on a spot. um, if you want an honest answer, in a polluted city like Mumbai, when, after a certain age, say after 25, 26, uh, your collagen starts to reduce by 1% per year. And because it's so polluted and we lead stressful lives, there's a lot of accumulation of soot and dust and all of that, and a lot of dead skin. And the process of exfoliation slows down because of pollution, because of stress, the lifestyle that we lead, the food that we eat. So the normal cycle of 28 days slows down, and you accumulate a lot of gunk on your skin. So, getting a facial done to cleanse your skin, maybe once in 2 months, is all right. Now, that doesn't mean you have to go to a salon. You can actually do that process at home.
Oh, okay.
You don't need a massage and all of that. You need cleansing. So, you can do that on a day to day basis by taking care of your skin. So, is it mandatory? No. It's a feel good factor, it's a way to pamper yourself. It's because you're so busy and you don't have the time to take care of your skin, and you want to cleanse and get all that gunk off once in a while, because sometimes when the pores get really clogged, you develop whiteheads, blackheads, and all of that, and it's difficult for you to unclog your pores. So you may do a facial once in 2 3 months. But do you have to go to a place every week or every fortnight to do a facial? Definitely not. Does the facial help you to age gracefully or help in anti aging? Definitely not.
Wow.
Yeah. So people think, oh, I have to do facials because otherwise my skin will sag. That's a big myth.
And I think people need to understand this, because most people, from the time when I was young, people always believed that facials will keep your skin youthful.
Well, yeah, that's the biggest myth. So, what is really important when you talk about skin, we have to understand that skincare is holistic. So just using some very expensive products or not so expensive products is not, and saying that, I'm doing everything right from morning to night, I'm using the right serums and sunscreen, moisturizer, this, that, the other, but I'm not eating right, I'm not exercising, I am stressed, I am out in the pollution, my hormones are all over the place, I'm unhappy, I'm sad, it is going to reflect on my skin you
Absolutely.
know so when you talk of good skincare, if you want clear radiant skin, you need to make sure you have a good skincare routine, but you also eat right. You make sure you don't have sugar, you don't have alcohol, you don't smoke, all these vices. People are going to hate me, but it's very important. You have to make sure you sleep on time and follow the circadian rhythm. So, sleeping at 2 a.m. and saying, hey, I'm waking up at 2 p.m. the next day, so I have like so many hours of sleep, doesn't work. You have to sleep, you have to regularize your sleep. So, that's very important because that's when your good hormones, the melatonin, the growth hormone, all of them are repairing your skin and rejuvenating your skin, and the cortisol is going down.
And can you give some superfoods that can really affect your skin in a very positive way?
So, when we talk of superfoods, it's everything which is naturally colored, bright. So, right from all the greens, from spinach to kale to parsley to whatever green that we can talk of, to everything that looks orange in color, because then it's very rich in carotene. So, vitamin A. So, papayas, pumpkin, the carrots, beetroot. So, oranges and reds, the bell peppers, fruits which are brightly colored, like pomegranate, they have anthocyanins, tomatoes, all the berries, very rich in citric acid, alpha hydroxy acids, and all the possible antioxidants to detox your skin. So that's one chunk of it. The other superfood is all your seeds and nuts, because you need a certain amount of omega-3 naturally, certain amount of good fats for your skin to glow. So whether it's flax seeds or sunflower seeds or pumpkin seeds to almonds to walnuts, don't do it in do it in moderation. So that's important. That's another chunk where you're getting your glow. And finally, what is your skin and your hair? What is collagen and what is hair? What is keratin? It's all protein. So we need to have a good amount of proteins in our diet. That's very important. So people say, "Oh, hair fall ho raha hai, biotin le lo." Biotin is not holy grail. It's not the only thing. So because hair would mean proteins, would mean vitamin A, B, C, D, E, iron, calcium, magnesium, selenium, all of that, all of that. So you need all of that. So these are the superfoods. And do not forget to drink water. So now at least I don't say 8 liters of water. I mean, science doesn't say that when it comes to skin, but at least 2 liters in a day to hydrate yourself.
Jaishree, there is a lot of confusion about sunscreen, and people tend to believe that sunscreen is largely for those who are fair skinned. So, is that true? And what is the correct understanding about sunscreen?
So, yeah, there are a lot of myths about sunscreen. One of them being that it's only for fair skinned people. When all shades of brown, like us Indians, we have something called eumelanin. And that melanin basically is protecting us, protecting our skin by about 13% to 14% from the sun. Now, when we talk of the sun, we talk of ultraviolet A, we talk of ultraviolet B, we talk of visible light, ultraviolet C, visible light, blue light, and infrared rays, right? So, all of these rays are going to damage our skin even if we are shades of brown. So the melanin will get affected. The cells which produce melanin will multiply, or they will churn out more melanin. And so you either have sun allergies, or you have blotchy skin, or you have something called pityriasis alba, which is white patches on the face and exposed parts of the body, or you have hyperpigmentation, or a faster rate of collagen degradation leading to fine lines, wrinkles, and all the signs of aging. So all of that can happen to shades of brown too, at a slower rate if you compare it to the Caucasian skin, to the fair skin, you know. So we are definitely at an advantage, but that doesn't mean we don't suffer, and that doesn't mean we don't get skin cancer. We will probably, when it comes to skin cancer, uh, as opposed to, I'll tell you, when I was in the US doing my fellowship back in the day, about 25 years ago, I would see at that time about 20, easily 20 skin cancers in a day. Yeah, that's the disadvantage of fair skin. But because we have this higher amount of eumelanin, this doesn't happen in India. I mean, I might see a skin cancer once in 3, 4 months or 6 months, just one. So that's the beauty. But everything else, and in fact, shades of brown hyperpigment more. We have post inflammatory hyperpigmentation. That's our number one skin concern, more than acne.
Once you wear sunscreen in the morning, you don't need sunscreen then after that. So, is that the right way of applying sunscreen, or is there a different process that you need to follow to maintain your skin from getting affected with different kind of lights which are there?
So, only if you're exposed to a lot of blue light, like the laptop or your computer screen all day long, say for over 4 hours in a day, then you need to be more cautious. But if you are in, indoors, closed rooms, you don't have large French windows with a lot of light coming in, then using a sunscreen in the morning and then probably after 4 or 5 hours another application is more than enough. The rule is 2 fingers, which people don't follow. So usually people will apply this much of sunscreen, which is not enough. You have to apply this much. Now, again, people will say, oh, it's not practical because it looks very white and it forms a white cast and all of that. But there are very nice newer sunscreens which do not form a cast. In fact, there are tinted sunscreens which protect. Tinted means iron oxide, and that actually protects us from all the blue light and the visible light. So you should opt for those, and that doesn't leave a white cast at all. So 2 fingers is the rule that you use on the face. And only if you're outdoors, say for over 2 hours, then even the best sunscreen or the most expensive sunscreen or whatever it is going to wear off. So, and if you sweat, of course. So then you need to reapply if you're outdoors after 2 or 3 hours. Now the challenge is if we have makeup on, how do we do it? So there are these powder sunscreens that are available now, and you just dab on the face. And so your makeup also stays, it doesn't get spoiled, and you have the benefit of both, reapplication of your sunscreen as well as not having to do your makeup again.
And are these powdered sunscreens available in India?
They're available now in India.
Wow. Can you name a couple of brands if I mean we are not promoting them, but just for people's convenience?
So there's, I think, Color Science, there's Isdin, which is a Spanish company, and I use Isdin all the
I
time.
use Isdin too.
Yeah. So that, and then I think Dermaco has, it's an Indian brand. I think they have a powder sunscreen. Yeah, 3 of these brands.
So does that mean that sunscreen is required indoors as well? It's not just when you're stepping out in the light. Also, when you're at home, you need sunscreen.
Absolutely. So what happens is 70% of ultraviolet A penetrates glass. So as I said, if you have light coming indoors, like in my clinic, it's just well lit. Even my house, there's sun from all directions. So even if I have windows, we have 70% penetrating in, then there's visible light. Therefore, you need to wear a sunscreen. And a lot of times, if you have balconies and you're stepping out, it's important. And as I said, if you have a lot of exposure to your laptop for over 4 hours, then you need a sunscreen even indoors.
Wonderful. That's quite an insight, because a lot of people have this misconception that only when I see sun I need sunscreen. Otherwise I don't need it.
I have patients who come and say that, I travel by car, so it's only from my house to the car, and then from the car to the wherever, the office or whatever. It's hardly 1 minute or whatever. But the thing is, if you don't have that shield, the sun protective shield, which anyway we are not allowed unless you are some VVIP. If you're sitting in your car, sometimes you'll have a patient come with only this side becoming dark because you're sitting next to the window, and you are constantly exposed to that ultraviolet A. So therefore you need a sunscreen even if you are traveling by the most expensive Porsche or whatever.
True. A very interesting question I want to ask you is that what kind of people usually come to you, and what are the most common concerns that you address when you meet your patients?
That's interesting. So, I run two clinics. One is in New Bombay. I started there in the year 1999, December 1999. And the other clinic is in Khar, which, I started practice in Bandra in 2006. So my clientele that side, even now, I see a lot of dermat. So I see a lot of psoriasis, eczemas, of course, acne, hyperpigmentation is common at both the places. And now I also do, my forte is aesthetics. I train internationally. I train people how to do Botox, fillers, threads, lasers, all of that in the US, in Europe, and of course in India. So I have a mix of both. And these days, I have to tell you that even there is no gender specific clientele that comes. So I have an equal number of men coming to the clinic who want to look better. So apart from the dermat aspect, I have people who want to just come and look nicer, want clear skin, want radiant skin, want to feel good about themselves. Um, I have guys who come with maybe some pimples here and there, and then after I give them a prescription, maybe the second or third visit, the skin has cleared, and then I'll say, okay, now your treatment is done. They're like, no, doc, but don't you want us to come for some facials every month? And I feel happy that, okay, you are nurturing your skin and respecting your skin and taking care of your skin. So a lot of them now want their skin to look nicer. But there is another chunk which is completely blinded by social media and the filters and the apps and all of that. And they constantly are also looking at these influencers, or the uh, Kendall Jenners and the Kylie Jenners, and they want to look like them, or they want to look like whatever they see on those filters. And that's a scary part, where you want to look like somebody else, affect your mental psyche. So there is nothing like glass skin or picture perfect skin, you know. And to be able to teach them science, handhold them, show them pictures of my own self and show them my skin, that look, I too have a little bit of pigment here, which is normal, which I accept, which has come because of certain hormonal changes which I went through, when back in the day when I was trying to conceive. So all of that, and trying to show them the positive things on their, the positive aspects of their skin, their face, their body. um, I think that's what I tend to do a lot and try to help them out. Of course, that doesn't mean, I sit back and say, oh, you don't need anything, go away. You know, I will tell them, okay, this is the right kind of skincare that you need. Maybe we can tweak a little bit. Maybe, if somebody has really hollow under eyes and is looking tired all the time, I might do some PRP treatment, or I might do something called PDRN, which is obtained from salmon sperms. It's DNA obtained from salmon sperms. Sometimes I might do under eye fillers. There's nothing harm in doing that. But the thing is, you have to know where to draw the line and remember that less is more. So that is something that I would do. I would help them out. If something's constantly nagging you, and as you age, and with the phones, it's not just about age, constant cell phone and laptop, if you're developing that number 11 and you look like you're frowning all the time, that I don't mind doing a little bit of Botox there, but a little baby Botox to just ease out that line, but not make the line disappear. And so your family says, wow, like now my wife or my mother is not angry anymore. There's no harm. But making them understand that they have to be best versions of themselves. And beauty is not about perfection, but it's about individuality and to embrace yourself and to embrace your color. It's important to have a nice, even tone. But if you are a darker shade of brown, you're beautiful, you're gorgeous, you know? And so that hand holding, rather than just running a business and saying, okay, you've come here, that the 10 things that you have to do, that's not, that will take you to places. And that's really so important.
Absolutely, absolutely. And I want to understand from you, Jaishree, what is this collagen business? Because every second ad on Instagram or on social media platform is that either you eat collagen or you drink collagen or there is some form of collagen. So what is this facade about collagen? And does it really work?
So, collagen is basically our framework. It's keeping our skin intact, and it's also there in our joints and in our and in the body. As we age, it degrades. The collagen degrades. The elastin fibers degrade. Collagen is nothing but protein, amino acids put together. And so when it degrades, if you want to look youthful, you want the collagen to rebuild. It will not happen if you take it orally. All right. So there is very little research. Maybe in due course of time we will reach there, but as of today, there's very little research which shows that if you take oral collagen, maybe your skin will improve a little bit, maybe by 10%, 20%, maybe it'll glow. But is it going to make you look 5 years younger? No. Is it going to make your skin firm, your sag go away, your wrinkles disappear? No. We've still not reached there. If you put collagen creams and serums and whatever on your skin, it's a very large molecule. It's not going to get absorbed. So again, no, it's not going to work. What can help collagen rebuild is ingredients like retinoids and peptides and alpha hydroxy acids that you can apply on the skin, which will help to rebuild collagen over a period of time. What will help to rebuild collagen is a good amount of proteins in your diet, and you can take amino acid supplements. And then you can also go in for treatments like simple treatments like an alpha hydroxy peel or a microneedling. Or if you are, say, above 40, then you can do a radiofrequency or a HIFU treatment to build collagen, a PRP or a skin booster to build collagen. So these are the different ways to build collagen. Eating or applying some random collagen is not going to help. If you want to apply, you apply something which has a retinoid in it or something which has a peptide in it.
My God. So people have been thinking that collagen is something that you eat and your skin is going to glow naturally.
I wish.
I know. And this has been such a myth that people have been following.
We may at some point reach there, because right now, if you take a scoop of collagen, 1/10 of that may be doing some benefit to you. But maybe in due course of time, it'll happen. Right now, no.
So, Jaishree, Botox and fillers are considered to be luxury treatments. Can you throw some light on this, because they are also considered to be expensive? So who can benefit from it, and how does it work on everybody's skin?
I'm so glad you said it. They're two very different things. Botox is a medicine. It's given to a 10-year-old who has a cerebral palsy. It's given for blepharospasm, which is eyelid paralysis. It's given for cervical dystonias, for migraines, for excessive sweating. So it's actually a medicine which neurologists give, which surgeons, my husband's a a GI surgeon and a bariatric surgeon. So when he repairs hernias and stuff, they use it. So it has a lot of, indications which are non-aesthetic. But Botox will also reduce your, muscle movement, restrict your muscle movement. And so the lines which appear due to constant muscle movement, like if you are constantly moving these muscles here, the procetus and corrugators, you get the number 11. If you are a very happy person who's laughing all the time, or even if you're exposed to a lot of sun, then you get crow's feet here because of the orbicularis oculi muscle here. You get forehead lines because, again, of raising your brows constantly. So Botox, when you inject it like a medicine, it'll get into these muscles and it'll slow down the movement. And so the lines start to disappear, right? The effect of Botox will only last for about 4 months. Now, first of all, it's not Botox. Botox is a trade name. The generic is botulinum toxin. And there is Botox, which is made by AbbVie. There is Dysport, made by Galderma. There's Xeomin, which is by Merz. There are many others. There's one called Daxxify, which is going to come now in the Indian market, hopefully soon. It's already started in the US. So these are different brands. Botox is a brand, So all these muscles, so your forehead lines, frown lines, crow's feet, these lines are called bunny's lines if you don't like them, or if they become very prominent with age. These can be either erased or reduced, softened. So the mantra is to soften them and not erase them, because when you erase them, you look like frozen people, right? So you give tiny doses of Botox to soften the lines. Botox is also given into a muscle here called masseter. So when you're constantly chewing, or if you have bruxism where, you're clenching your teeth at night, not realizing, or if you're lifting heavy weights and you clench your teeth constantly, this muscle here starts to bulk up. Just like when you exercise, the muscles bulk up. And then slowly your lower part of the face becomes more square and sometimes even like this. And so if you inject botulinum toxin into this, the muscle shrinks and you get a more oval and chiseled face. It's very nice for females. So when you inject botulinum toxin into this masseter muscle, which has become bulkier, it tends to shrink, and therefore your jawline becomes more contoured, and females love it. You've got to be more careful in men because men want that squarish face. You can also inject Botox into these bands here, as we age. There's a muscle here called platysma, which weakens, and then you get these bands here. When you have aches and pains in the shoulder constantly, you can take Botox there. Now, when you give Botox here into this muscle, this becomes flatter and your neck looks more slender. So that was the Barbie neck that became very, famous. But that also helps ease the pain that you have here. Migraines, So that is Botox. The effect lasts for 4 months. Then the effect wears off. And if you want to redo, you can redo. If you don't want to redo, there is no harm. People have this misconception that if I don't do it, I will look worse. That doesn't happen, because when you don't do it, you've just not allowed the muscle to move that much, so you're actually probably 10% better. But a lot of times, people tend to overdo. So if I need, say, 12 units here and I do 24, I'll be frozen. And that is not right. So overdoing or crossing the line is something that will make you look fake. That's Botox. Then you have fillers. Fillers come as these pre-filled syringes of hyaluronic acid, and that is why they're called fillers. Now, they're either used to contour the face. So as we age, because our bone, the muscle, the fat which is inside, all of that support that the face has, the skin has, is sort of getting degraded, and you're losing all of that. So the foundation goes and the skin on top doesn't have any kind of support, and so it begins to drop down and you sag. So fillers can actually help lift that to a certain extent if you start early, not when the whole building has collapsed. And if you have hollow eyes, if you have very thin lips, as we age, also our lips become thin because of loss of fat and loss of volume. If you have, hollow cheeks, or your chin is very small, or your jawline is sagging, you can inject fillers and recreate the structure. Again, when you overdo, if you put too much here, then you have those apple cheeks. If you put a lot in the lip, it looks like ducks. If you put a lot of filler under the eye, your eyes begin to look chinky. They're very small. So do not be in that, that lookout that, I should not have any hollow under my eye. Let it look natural. So fill in a little so that you still have a little bit of hollow, but it doesn't look tired. So again, the key here is less is more. See, we've been seeing a lot of people now talking about, oh, no, 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 fillers are bad, and see how Madonna looked. Yes, that's because she did probably, back in the day, they were doing 12 syringes, 16 syringes. The mantra should always be less is more, even when it comes to fillers. And now coming to your question of how expensive is it? These days, even facials are expensive, right? So if you are trying to do ease out your frown line, if I may calculate, it comes to about 4,800 rupees, and it'll last you for about 4 months. You know, I don't think it's that expensive for some. It may be expensive for some. It's a very subjective thing, cost. But most facials these days are for 4,000, 5,000, 6,000 rupees. So if those lines are going to disappear and make you look less angry, I think the purpose is solved. And you can look at it in that kind of an investment. Fillers, probably a syringe would cost you anything between 18 to 25 to 30,000, one syringe. And so about 2 to 3 syringes. Again, that will last you for about a year. So then you need to calculate if it's that expensive, or, if you can't do it, there are other kind of treatments. There is PRP, which is also known as the vampire facial. We have radio frequency skin tightening. So they can all be done. However, most people can afford it. It is not something which only celebrities do. In fact, I have more non-celebrities opting for aesthetic treatments now. And I do a mix of fillers, Botox, and regenerative medicine. I do a lot of regenerative medicine now. PDRN, which is polydeoxyribonucleic acid, which is an extract, as I said, from salmon sperms and trout sperms. It's DNA. There's something called exosomes, which are obtained either from plants or from umbilical cord. So you take that, and then with microneedling you use it, and you do all these. You have skin boosters like Profilo, like Skinvive. These will help to boost your normal collagen. So you don't change anything on your face. You just help it look more youthful and maybe 5 years younger. So you look like your own self, but you look like a more youthful self. I think you age youthfully. Now, are they replacements of Botox? Somebody sent me a thing, an Instagram reel saying, oh, Botox is going to go away. No, it's not. Because until you have something which is really going to make those lines completely disappear, if you start early with your skincare, maybe you will age slower. But you can't, if the lines have appeared, then there is nothing which is going to replace a Botox. They are in phase three trials now with a cream which is going to help. So let's see. But as of now, no. You still don't have a replacement. You still don't have a replacement for a chin filler or a lip filler other than a surgery. You may do a lip lift, or you may do a fat graft or an implant, But a non-surgical way or a regenerative way, saying, oh, I'm doing PRP to, make my lips thicker, no, that doesn't work. So you have to have a balance of everything, like a mix of everything, where you do less of fillers and Botox and more of regenerative medicine, more of things to make you look youthful naturally. But wherever it's required the right way.
Absolutely. When it comes to the celebrities, we always see the before afters of people who've just made an entry into the movies, and then when you see them a couple of years later, for example, Deepika Padukone. Now, when she made an entry into the movies, she was slightly darker. Uh, she had little different features as compared to what she has now. She has a more pointy chin. She has little more glowy skin, and her face shape is also slightly different. So, how and who gives them this kind of feedback that this is what you need? Or is it their own self evaluation that they get when they see themselves on the screen? Or are there practitioners like yourself who give such feedback that if you do this, maybe you'll look better? So, how does the whole thing work?
I think it's a blend of all three. It's a blend of what they see and perceive, what we see and perceive and explain to them, and what the directors sometimes want. Sometimes they want the faces to be a particular way. I've had people come to me and say, she's playing this character, so you have to make her look glamorous. So for that movie, she's going to look glamorous, or he's going to look 10 years younger. And then for the next, they're going to look like themselves, you know. But the evolving of a face that you're talking about uh, can evolve in a nicer way, like Deepika. I think she's gorgeous, right? But we have to understand that it's not always fillers and Botox as people feel. It's also a lot of hard work, you know. So when you eat right and you exercise the right way and you lose a lot of weight, your features change, you know. So when your all that chubbiness goes away, your bone structure, if it is inherently good, it starts to show. Sometimes people ask me, has she done a nose job? And I'm like, some person. And I'm like, no, I'm 1000% confident that she hasn't. It's just that the fat has gone, and the nose looks sharper, you know. So it does happen if you really take care. And if you start with taking care of your skin and doing these regenerative treatments at an early age. Like, for example, I have a patient who has been coming to me since 2009. Okay. Today she's 60 plus and she looks not more than 50. And I have never done fillers for her. And I know for sure she's not going anywhere because she's in my clinic every month. So I'm looking at her very closely. But from 2009 to now, we are doing something or the other without injections, you know, maybe a radio frequency skin tightening every 3 months, maybe a high intensity focused ultrasound once in 6 months, some skin boosters, which are injections, but they're not fillers and Botox. So if you start early, probably she was around 40 at that time, or maybe 45, and now she's 60, you know. So the last 15 years have been slow care, and she looks not like a different person, but like her features look sharper and she looks younger. So it's possible. And maybe a little bit of tweaking. Maybe thoda sa chin filler kar diya. You don't have to do it every year. A chin filler will last you for 4 years, 5 years, you know. So yeah, that's how it is.
And a lot of people also believe that we don't want to get into this invasive treatments. People are very averse to the fact that some people, I would say not all, but they don't want to inject anything on their face. मैं सब कुछ कर लूंगी, मैं इंजेक्शन नहीं लगवाऊंगी, या मैं कुछ सर्जरी नहीं करवाऊंगी, या मैं ऑपरेशन नहीं करवाऊंगा. I just want a natural way or natural process of aging. I can get everything else done, but no invasive procedures on my face. So, in that case, you said radio frequency.
So, I respect their decision. I will not force them to do anything. But I also will tell them what is their expectation, right? So, if their expectation is that I'm okay with my frown lines and I'm okay with my crow's feet and I'm okay with my thin lips, we can do non surgical radiofrequency skin tightening. We can do ultrasound, that is high intensity focused ultrasound. We can do treatments like microneedling, exosome therapy, PDRN. All of these treatments will not involve injecting something into your face, and still tighten your collagen and improve the sagging and improve the entire contour of the face and the body. So it's possible. But you have to start at the right time. You can't say, I will start when I'm 50, because by then the whole breakdown has happened. The building has collapsed. So the key is to start early, which a lot of Indians do not realize. They come and say, oh, just give us a skincare routine because I think I want to delay it as much as possible, but not realizing that when you're delaying these treatments, um, the damage is so much that only a surgery will be able to reverse it, or only some injectable will be able to reverse it. Now, that doesn't mean I'm saying go to a skin clinic or a salon every week. I'm just saying maybe 3 treatments in a year.
Oh, that's it.
Yeah, 3 or 4 in a year max. I do 4 treatments in a year for myself. I'm 51, you know. So, but yeah, I don't have that kind of time, first of all.
And in fact, I wanted to ask you that what do you do for your skin, because your skin is so amazing, very, very
Thank
glowing
you.
skin.
Thank you so much. So I have to. Um, I so 20% is also genes. 20% is your diet. 20% is your lifestyle, and 40% is the treatments that you do on your skincare. So I'm very, very particular about using a sunscreen every single day. I don't think I have skipped a sunscreen in the last 25 years, ever, even if I'm ill. The second is I love my retinoids. Now, some people may not tolerate it, but my skin tolerates it well, and I use it every day. And then I do something called Profilo, which is a skin booster, which I do twice in a year for my face. For my neck, I do it maybe 3 or 4 times in a year. I do HIFU, which is the high intensity focused ultrasound therapy. I do that twice in a year. So this is my all in all skincare that I do. Um, I don't do Botox because I don't get so many lines. If I would get, I would do it. I used to do Botox back in the day for my migraines, but now I don't get migraines so often. I used to otherwise get a lot of migraine, but now I don't. So when I used to do it, obviously my forehead would look smoother, but now you can see now. Of course, she's done beautiful makeup, but you can see the lines now. Um, I used to do Botox for my masseters because they were really huge. If you see my cover page on Skin Talks, I look like a different person now because I used to do a lot of Botox for my masseters, but slowly that has shrunk. So I don't find the need now. So I don't do it anymore. Um, yeah, so that's what I do.
So, a lot of people want to understand that what are the biggest mistakes they make when they have acne.
So whatever they see on social media, they want to buy and apply. Whether it's some friend has said this salicylic acid serum has worked for me, or this multani mitti has worked for me, or some home remedy like a toothpaste or baking soda has worked for me, they're going to try all of that, which is a complete no-no. The second thing is, mixing all these fruits, lime, lemon, uh, and then tomato juice and all of that, very acidic. It will change the pH of your skin and irritate your skin more. And it will also break the skin barrier, make your skin more sensitive. So please don't try all these things if you have acne. Then overusing products, in the hope that the skin is going to get clear. Well, then the skin is getting more clogged and confused. You know, popping their pimples, or acne, or trying to remove that blackhead or whitehead. In the process, you are damaging the deeper layers of your skin. You are also allowing more bacteria to go in, and therefore there is more infection, and there's also scarring and pigmentation and blemishes. So that's another thing that people, so self medication, home remedies, popping the pimples, not going to the right doctor, just following things that your friends have used, or your actors or your models are talking about. uh, I think it's important to take good care of your skin, or not eating right. So if you have acne, you know, the hormone IGF-1 is going to increase. And that increases with milk, it increases with sugar, jaggery. maida, honey, dates, very sugary fruits, potatoes, food with high glycemic index, so burgers, pizzas. You've got to stop having all of that and not say, I'm going to have a cheat diet. It doesn't work. So then the hormone will increase if you have any of these, and then it'll send signals to the brain that sends signals to either your oil glands or to your ovaries. So it's a full process, you know. And then you have more oil, and when you have more oil secretion, you have more bacteria called Cutibacterium acne, which will grow because it's food for them. And then you have pimples. So that whole cascade is triggered by wrong diet, um, and wrong skincare, using makeup brushes and beauty blenders and products which are not clean, your pillow covers if they're not changed way too often, your cell phone if it's constantly touching your cheeks. So all these are mistakes that people do, not realizing that you are growing more microorganisms on your face and probably also clogging your pores and giving rise to acne. So please consult with your dermatologist, eat right. Hygiene is very important, maintain that. And stress will also aggravate acne.
I think to some extent, when you already have acne and you're stressing about it, it only aggravates
Oh
it.
yes, the moment you have acne and you stress about it, your cortisol level increases. And when that increases, again, the whole cycle changes and you have more signals to produce oil.
So tell me, Jaishree, are teenagers the right candidates to come and see you for their skin?
In today's day and age, most definitely. Before they try 10,000 products which are available on Instagram and get overwhelmed, um, or feel like, oh, I can't afford so many things. Both ways. Some of them can afford, so they'll buy so many and they'll use everything and spoil their skin. Some of them can't afford, and so they are in that shell. So I think it's important for every individual, start at when you're in your teens, consult with a dermatologist, get to know your skin type, get to know what is right for you, and do not use too many products on your skin. Even there, less is more. you know do not forget to cleanse your face, do not forget to moisturize your skin, do not forget to use a sunscreen.
Even for teenagers?
Yeah, even for teenagers.
So, what is the right age to start sunscreen, and what kind of sunscreen is recommended for that kind of age group?
So physical sunscreens which have more zinc oxide and titanium dioxide are very safe for children, and there are specific sunscreens for children. And so if you're above the age of 1, and I usually say 2, you can start using physical sunscreens if you have a lot of outdoor activity. Um, Otherwise, you can, after the age of 16, you can use the regular sunscreens. And always use a sunscreen which has a combination of a physical and a chemical component in it, because then it will also give you a coverage, a broad spectrum coverage from UVA, B, C, visible light, infrared rays, and blue light.
Wow, because children nowadays, as you ads
Oh, yes.
and computers. So, for them, I'm sure that the way you are recommending that they should also use sunscreen, it becomes even more mandatory for them to apply because at that age group, nobody is bothered about their skin much.
Absolutely. And then the repercussions are faced later on in life. And so if you use a mild, pediatric sunscreen, which has more minerals than chemicals, it's absolutely safe.
And at this point, I would also like to add to this that they are the ones who are also very conscious about their looks because of the exposure that they have, because they are exposed to internet, and they also know that uh, their friends, their peers, everybody who has certain body image related issues, they are made fun of.
Oh, completely. I have 11-year-olds, 12-year-olds, 13-year-olds who they seem to know everything, about skin. They will come and teach you. They're so well read now. And thanks to social media, they know about ingredients. A lot of times, of course, there's misinformation that they know. Um, and as you rightly said, they're hooked on to blue light all the time from their iPads and their cell phones. And so that little amount of skincare is important, and the right skincare is important.
I also want to know about skincare curing PCOD, because that is a time when, especially the young generation, the girls, probably, older girls, younger girls, especially girls who are 20 plus, they have this kind of acne on their jawline. So, what is it that they need to do? Because that brings a lot of stress. And especially at that age, you know how conscious they are about their looks. And if they have that, very bluish, purplish kind of line on their jawline, it looks very, um, I would not say ugly, but it would be a very
Very
unpleasant
unpleasant.
experience.
Yeah. Yeah. So, I'll tell you something very interesting about PCOS. When I started my practice 25 years ago, um, maybe one case of PCOS in a week. And I used to see 100, patients back then because I used to do a lot of dermat. Um, Now, every other person who walks into the clinic, every other girl, be it an 18-year-old or a 30-year-old, has PCOS. So eight out of 10 will have PCOS, which means it's a lifestyle disorder. And there was this German study which showed that pollution has a major role to play,
I was coming to that.
you know. So pollution and lifestyle, stress, diet, sleep. So it's a condition, polycystic ovarian disease, wherein you may or may not have regular periods. Now, everybody thinks, oh, I have to have irregular periods to be termed as PCOD or PCOS. No. You may have acne, you may have hair fall, you may have hair growth, abnormal hair growth on the body. You may have weight issues. There's one form which is called lean PCOS, where they're very, very thin, but most of them are obese, you know, have difficulty in losing weight. Then you will have hyperpigmentation, so like a thick band around your nose, around your neck, underarms, around the eyes, a conditions called acanthosis. So all of these come under the PCOS category, and it can really play havoc on your mind. And so it's important to improve your lifestyle. And so what you need to do is, of course, for your skin type, you will need to use a salicylic acid or a green tea or a tea tree oil based face wash or a glycolic acid based face wash, which will help to unclog the pores and to a certain extent uh, kill the microorganisms which are on the surface. Then you use a salicylic acid based serum maybe 2 or 3 times in a week at bedtime. Salicylic acid is lipophilic, so it'll get into the pores, it'll break the lipids or the fat, and it'll help to unclog the pores. So you use that 2 or 3 times in a week. With the help of a dermatologist, you would probably use a retinoid, which is right for you. Again, maybe 2 or 3 times in a week. Don't just use random retinols. Then maybe if you have pustules or cystic lesions, your dermatologist may give you an antibiotic cream. And then if you do not heal with all of that and lifestyle changes, which means the right diet, which has low glycemic index and no sugar, no milk, uh, sleep pattern has to be normal, exercise has to be on point, stress levels have to be curtailed, they have to be, you need to cope with it. So all of that in place. And then if you're still not improving, then you will need some oral medication as well. Your gynecologist or endocrinologist may have to intervene. Your nutritionist may have to intervene to help you lose weight. And if you have to take certain medicines at that point of time, there is no harm. Because remember, if PCOS is too severe, you have issues conceiving also. So, all of that together, put together, will help in controlling your PCOS. So, do not feel dejected and sad and hopeless because it's all in your hands. If you lead a healthy lifestyle, a lot of times you don't even need medication. And where you need, you may take it for a couple of months.
Wonderful. Thank you. Uh, if a busy professional or a student can use only three skincare products, what would they be?
Very simple. Cleanse. So, a good face wash, depending on your skin type. So, if you have oily skin, as I said, something which is salicylic acid or glycolic acid or green tea or tea tree. If you have normal skin, just use anything. And if you have dry skin, use a cream based or an oil based cleanser. The second would be a moisturizer. So, again, depending on your skin type, if you have oily skin or acne prone skin, use a water based or a gel based moisturizer. If you have dry skin, use a heavy cream based moisturizer, a heavier one at night, a lighter one during the day, something which has hyaluronic acid, glycerine, dimethicone, squalene, that is during the day. At night, maybe shea butter, cocoa butter, squalene. So, no compromises on a moisturizer, even if you have oily skin. And then a sunscreen. So, again, depending on your skin type, if you have oily skin, you have matte and gel based and water based sunscreens these days. And you have heavier cream based sunscreens for drier skin. You have mineral based sunscreens for pregnant women, for youngsters, for people who have very sensitive skin. Just make sure your products don't have fragrance in them, don't have added color in them. You know, some of them, if you have very sensitive skin, then parabens, phthalates, and all of those. Um, these days, you get products which don't have them. So use those. But I think by and large, if you just do this much and follow a good diet, you're good to go.
Jaishree, India is a country where people believe in fair and lovely procedures, fair and lovely skin, and the brand Fair and Lovely also sold to a great extent in India. Now, if somebody who's a darker skin wants to become fairer, relatively fairer, are there any ways and means to do that?
Sure. Um, Sad but true. This is something that has been, it's it's uh, it's like poison. It's there in every village, town, city. Um, when I was small, my mom used to use Fair and Lovely. Of course, she had melasma, she had hyperpigmentation, and that was the cheapest cream, and she thought that would go. That was her reason. Her reason was not becoming fair, but that was the only cream we knew, and every household, I think, was using that cream. Um, and this thing about ये काला है, इसकी शादी नहीं होगी, ये बहुत काली है, या ये काला है, ये शायद इसको कोई अच्छी नौकरी नहीं मिलेगी, has started from the time I was a child, and it has continued even now. You know, I still have, when I started practice 25 years ago, I had patients who would say, ये बचपन में पैदा तो बहुत गोरा हुआ था, अब काला हो गया है. 10 साल का है यार, छोड़ दो, ये खेल रहा है, let him play, you know. But no, the psyche was, so it's in all age groups, it's in all strata of the society, and it's a plague.
I completely agree with that. In fact, I was sitting with one of my consultant yesterday. She's married, she's got 2 kids. And she said, ma'am, I always had this childhood trauma that I'm not good enough. I said, what made you say that? Because you're so good with what you do, your work, your accomplishments. And she said that I have always been told that you are savli because my other 2 siblings are fair.
Yeah, oh my God.
So that comparison has always lived in her head. And even today, when she's close to 50, she still feels that she's deficient. She still feels that she's not good enough because this skin comparison and this feeling of not having that kind of skin color has made such a strong impact on her mind, on her performance, on her productivity, on her feeling that maybe I'm not capable enough to do something good in life.
Yeah, yeah. I can't tell you how many such patients I deal with or I have dealt with in the last 25 years, where this feeling of not being good enough because I am dark, you know, and it's appalling how that childhood trauma can shape you into what you become eventually. And you live with that inferiority complex even if you do very well in life. Somewhere it's still there, you know, and that needs to be liberated. And I think all of us need to get together and, stop advertising fair skin. The fair people want to get fairer. But I think grass is always greener on the other side, because when you look at the Caucasians, they want to tan all the time,
Yes.
right? I think we need to embrace our color and say that all shades of brown are great. They're all good. And dusky skin is good. Wheatish is good. Whatever color. Um, I think we all look very attractive. All of us are attractive in our own ways. And that needs to be embraced. But having said that, the answer to your question is it possible? So there is a disease called vitiligo, leukoderma, right? And for to repigment leukoderma is a very slow process, and sometimes when it is extensive, it's not possible to repigment. And so there were these depigmenting medicines that were given to remove the rest of the color. So that's what Michael Jackson took, right? He probably, people don't know this, but he was not aiming to become a fair person. He had vitiligo. And yeah, he had vitiligo. And he was completely devastated. He was a public figure. And because of societal pressure, he had to take medicines to become the color that he became in order to hide his vitiligo or his leukoderma.
I think nobody knew this.
So the World Vitiligo Day, the Leukoderma Day, is celebrated on 25th of June because Michael Jackson passed away on that day, So in his honor, and because he suffered from vitiligo, and to make the world know that, this was the truth behind his color. So those were the drugs which slowly then people started using to become fair, and there are lasers, there are cryo chambers, there are chemical peels, especially phenol peels, and then now the glutathione drips that people do to become fairer. So all these modalities are there. However, everything comes with a price, right? So now if you take glutathione, you may have to overdose yourself to become fairer. Everybody who takes glutathione doesn't become fair. Glutathione is used for liver disorders, and it's been there in the market for a very long time. But one of the side effects is to break the pigment melanin. So not everybody gets that side effect, number one. And to get that side effect, you may have to overdose yourself. So when you overdose something, anything, even if it's a B complex, you will get a side effect, right? That's number one. You've got to keep that in mind. So if you are, if naturally with, say, a 1200 milligram of glutathione every alternate week or something, if your your skin is getting lighter, great. But if it's not, I mean, when I say great, I don't mean it's very good and you should do it. I just mean that, you are responsible. If you're not, and you then want to overdose yourself and do, I've seen people do 5,000, 10,000 milligrams, and that can affect your kidneys maybe. We don't know how it's going to affect your eyesight, the retina, because the retina also has melanin. And so if you're going to reduce the melanin from there, we don't know what's going to happen to your vision 10 years down the line. So again, you may use glutathione as a very potent antioxidant. Once in a while, you can take the medicine. It comes in an IV drip. But take it as an antioxidant, not to become fair. Don't do it like repeatedly for a very long time. The other thing about glutathione is when you stop it, slowly over 6 months, your color comes back to normal.
Oh, so that means that you have to do it as an ongoing process.
Yes. So you have to do a maintenance dose. You have to either take oral supplements. So all of that. So, I have to tell you that back in the day, media and television and even films, movies, they had a huge role to play in this. Now that thing is gone. I mean, you can be of any color and you can still be an actor and a very good actor, and you're still cast. But back in the day, you had to be fair to be cast as a model or a heroine, you know. And even a male, if you were dark, you were a villain.
Yeah, absolutely.
Not realizing that even all our gods, from Rama to Shiva to everybody to Krishna, they were dusky, or that's why they are depicted as blue, you know. And we forgot that somewhere, and we started aping all the invasions which happened into our country, from the Aryans to the French and Portuguese and Mughals, and then of course the English. And then the whole culture of, uh, being fair means you are of a certain strata and you are the higher society and you are better. I think all of that needs to, it is changing now. But yeah, it's like a bit of this and a bit of that, because people still want to be fair.
But I think to a great extent, people, although they are wanting to be fair, the new generation has started accepting themselves in a great way in terms of, embracing what they have. So, be it a dark skin, be it a wheatish skin or a dusky skin, their reaction to the whole thing is that, "ठीक है, I'm born with this. You tell me what would look good on me."
Absolutely. So it's a lot easier, in fact, in the clinics also, to deal with this younger generation when it comes to all of this, because to them, it's to hell with the color. I'm not bothered. Um, they have a better mindset, you know, they're more open to accepting and embracing and including, that inclusivity is there in them. And I think it's a very good change.
And this is what we have been educating as image professionals, image management professionals, that what you have, accept it, embrace it, and work on enhancing it further. So, for example, even if somebody comes with a particular kind of color, we actually guide them that what are your personal colors, and then what are the colors that would really enhance those colors which you were born naturally with, and then that really enhances their confidence to another level.
Absolutely. Absolutely. I mean, uh, that's what we should all do, in fact, in our professions. You as an image consultant, me as a dermatologist, you know, a nutritionist, or whoever, everybody together um, should now take this forward, and create that awareness among people, that inclusion, embracing your features, embracing your color, embracing everything about you, what your parents have given you, your genes, with a little bit of tweaking here and there to just become better versions of yourself, but not clones of some other people,
Very true,
um,
very true.
should be advocated.
So, Jaishree, what are some of the anti aging ingredients that you can find for Indian skin that everyone should have access to or can work with on a day to day scenario?
So, since you said Indian skin, our age old turmeric is a very good, curcumin is a very good anti aging ingredient. It is also something which helps to, um, you know, improve your overall skin texture and tone. So, to get an even tone, to get a more youthful look, you can use haldi, right? Whether you use it from your kitchen, but then it should not be contaminated, it should be pure. Sandalwood also, to a certain extent, helps, but not in those who have eczemas, because then that's fragrance. And sometimes natural fragrance can also increase your eczema. So you've got to be careful on that. Aloe vera is very good because it's a wound healing agent and it repairs the skin. But again, there are some people who are allergic to aloe vera, so always do a test patch. All these ingredients, you must do a test patch. And when you're doing a test patch, don't do it on your hand, do it behind the ear or do it in your chin, because the skin on the face is very different from the skin on your hand. Then the more potent ingredients which are available in the market are retinoids and peptides and alpha hydroxy acids. Um, I think a retinoid is the gold standard. Not safe in pregnancy, but otherwise, um, you should start using it at the age of 30 and then continue to use it. And there's a right way to use it. You start with once in a day application and the right concentration. There are retinols, there are retinyl esters, there's retinaldehyde, there are, then there are retinoids like tretinoin. So there are so many types. Yeah.
Under
Yeah.
the supervision of a dermatologist?
Always under the supervision of a dermatologist, because you can't just start using a retinol on your own. Your skin will break out, you'll have flaking, you'll have rashes, you'll have irritation if you don't use it the right way. And if you are overdoing it, again, it's bad for your skin. And if you're underdoing it and using the wrong concentration, you're not going to get any results. So, it's a wonderful, versatile, multi-purpose ingredient, but it should be used the right way. Peptides are safe, on the other hand, and they can be used by anybody. So, usually, again, after the age of 30, 35 is when I say start using peptides as well. Alpha hydroxy acids. Okay, so pomegranate, sugarcane. Now, don't squeeze them and use them on your face, but these are extracts which are then put in a bottle, and they come as alpha hydroxy acids, and they're great for your skin. If your skin is sensitive, then lactic acid is great, which is milk. You know, my mom used to apply malai on my face every single day at night. I used to hate it, but I realized it was lactic acid. So it was moisturizing my skin, and it also has skin brightening properties. So I think that's what kept
वो
my
दिख रही
skin
है.
very supple.
I can see that malai on your skin.
On my skin. So lactic acid, which is doodh and dahi. Again, if you have acne prone skin, you can't do it, unfortunately. But if you have normal skin, if you have dry skin, you can definitely go ahead and use doodh, dahi and malai on your skin. So these are also anti-aging or anti-aging ingredients.
And what is this new thing about soaking your face in the ice bowl or ice bucket or something like that? Is that something that really works on your open pores or your skin?
Very temporarily.
Oh, okay.
So what ice does is it will temporarily constrict your blood vessels. So when there is a little constriction, also what happens is there's a little shrinkage of collagen very temporarily. So your pores look less prominent, number one. And it also helps to depuff. So if you have a puffy face, and like a swollen face in the morning, you've had a late night, or you've had alcohol, or you've had a very salty meal the previous night. The next day in the morning when you wake up, your eyes or your face is puffy. That's when you dunk your face in ice, in a bowl of ice. So the lymphatic drainage sort of eases out and the puffiness goes away. But that's all that ice can do. So if your face is not puffy and you want to put your face in ice, it's not going to do anything. In fact, it's going to dehydrate your skin. So I have seen a lot of celebrities swear by it and say, oh, I do it every day and all of that. But that's probably because they have a very hectic lifestyle, or a lifestyle wherein they are sleeping late and they are, probably sometimes also partying for whatever because of their work. And in the bargain, they have puffiness in the day. Sometimes it's also hormones. Just before periods, a lot of females will have puffy eyes. So that's all that it does, if you have an open wound which is bleeding and you apply ice, what happens? The bleeding stops. That's what ice does. It vasoconstricts. Or if you have a burn and you apply ice, it calms it down and it really helps. So that's the function of ice. But otherwise, saying that I'm dunking my face in ice every day and I'm going to look young and it's going to make my collagen tighter and it's going to make my skin less saggy and my wrinkles disappear, that's not going to happen.
Wow, that's such a big myth that you've busted, Jaishree. Now we're coming to the last question, and this is breaking the mirror. What is that one myth about flawless skin and beauty standards that you would want to break today?
That flawless skin doesn't exist, right? Glass skin, perfect skin, flawless skin, no pores, no lines, no stretch marks. These are abnormal. It doesn't. Everybody will have pores. Everybody will have a little bit of imperfection. Everybody will have an asymmetry. One side of your face is never the identical twin of the other side, except for the lips. Okay. So, yeah, this is what I think, want to break and tell people that relax, chill. It's okay to have all these, and flawless doesn't exist. So, yeah, radiance
I
exists.
think just to add to that, I would like to share one incident where I went to a dermat and I wanted to show her my open pores. And while she was checking my skin, she told me that, oh my god, you have such a asymmetrical face. One side is very slim and the other side is very round. And your eye, one eye is smaller than the other one. And your nose is a hooked nose. And you really need to take care of that because it doesn't look nice when you have a side profile, to be given anywhere. And then you also have a double chin. And I was wondering that I had so many flaws in my face all this while, which I never noticed. And today I've noticed all the flaws. And am I like the most ugly person on this earth? And that gave me some sort of a feeling that, oh my God, I mean, what is wrong with me, seriously? And then I introspected and realized that, I mean, this is her way of seeing me. And my way of seeing myself is totally different. And what I went for was the only thing that I really wanted to focus on, nothing else, because that's her job. She wants to do. And if this is how somebody will give you an analysis of someone else's way of looking at things, or this is her lens of viewing me, I think I don't want to really, go by her version of my beauty standards. And my beauty standards in my eyes are absolutely perfect. I don't really need validation from somebody else.
I think that's the biggest thing, that we should not be looking out for validation from other people. You know, in fact, there is a joke which goes around where I say that when you're going to a dermat, look at your dermat, and then you know how you want to be. Because in my clinic it's the other way around, and I'm really not joking. You can ask my patients when they come to me and they say, this side is higher than this side. I immediately ask them to take a picture of mine on their cell phone and say, okay, now see. And then they're, oh my god, yes doc, you also are like this. I'm like, yeah, your left is never symmetrical. It's your left and right are never symmetrical. They cannot be identical twins, and that's what you need. That little bit of asymmetry looks lovely. It makes you the person that you are. It brings about that individuality. And there was a study which was done, which I often, in my lectures, I show that study where, they have morphed Angelina Jolie's left and right, or Priyanka Chopra's left and right, and made them look, like identical. And they just look like some other creatures. They don't look as good as they otherwise do.
And I think if you are perfect, you're not real.
You're not real.
True. And if you're not real, you're not authentic.
And also, this brings me to something very important, that if you're not real on the inside and not happy and authentic and true on the inside, you're never going to do justice to your skin, because your skin will never glow.
Absolutely. 100%. 100%. No matter what you do to your skin externally, but if you're not what you want to be from the inside, it will not reflect on the outside. Because that is where we also say that image is inside out, or the external is internalized. And that's what I would say, that the real beauty standards are the one which you embrace from within and outside, and that's the real beauty that you want to carry with you in terms of your legacy.
Yeah, absolutely.
Amazing. That was such an insightful conversation with you, Dr. Jaishree. And I really feel that after this interaction that we had today, this very insightful interaction that we had today, a lot of people will also understand the value of their own self, which is very important, because a lot of people don't find that value in, who they are in reality, how authenticity plays a very important role in their life. And true beauty standards are the standards which they embrace and accept. Self-acceptance, self-care is equal to self-love.
Absolutely.
Thank you so much, and it was lovely having you on Perception and Beyond.
Thank you for having me. I just loved being here with you.
होप इस कॉन्वर्सेशन ने आपको फ्लॉलेस स्किन और ब्यूटी स्टैंडर्ड्स के पीछे का सच समझाने में मदद की होगी। रियल ब्यूटी फिल्टर से नहीं, सेल्फ केयर और कॉन्फिडेंस से आती है। अगर आपको ये एपिसोड पसंद आया तो लाइक, शेयर और सब्सक्राइब जरूर करें ताकि आप और भी ऐसे इंसाइटफुल डिस्कशंस मिस ना करें। और हाँ, अगर आपको लगता है कि ये किसी और के काम आ सकता है तो उनके साथ जरूर शेयर करें। मिलते हैं नेक्स्ट एपिसोड में। स्टे कॉन्फिडेंट, स्टे रियल।